sunlight, temperance, air, rest, and trust. This is our on information. Welcome, 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 and welcome. Hello in all your languages. Our objectives are: 1, to meet your needs and provide support; 2, to draw sin-sick men and women to the man of Calvary, Jesus Christ; and number 3, to provide health suggestions for educational purposes only. Now, where are you linking us from? Please put it in the chat. Where are you linking us from? Did you put it in the chat? Thank you. Thank you for joining. Is this your first time? Please send us your email. Yes, we do have lifestyle coaches. This is a number. Oh yeah! And yes, we do take donations. Thank you.
Welcome again, everyone, to EYLN, Extending Your Life Naturally, a production of Healing of the Nations. I see we have 44 persons on. I am telling you, there is someone out there that's living with pain that don't have to live that way. So let us share that link with all our friends, all our neighbors, all our families, our coworkers, and the list goes on and on. Everyone that you have in your WhatsApp chat, I am asking you now, please, to send out that link to let them come on to the program. I welcome each and every one of you here today, and it's a pleasure. I see we have persons from Grenada, England, London, Florida. And again, we say welcome, welcome one, welcome all. It's a pleasure to have you all here because without you, there would not be a program. So we have to say thank you to all of you. Easy Appleseed, Jennifer, Caleb, the Bread of Life, every one of you that's on. We are grateful that you are here. So without further ado, we are going to highlight the services and events.
The Healing of the Nations presents weekly services. Tuesday, 6 a.m. to 6:30 a.m. Let's get walking. 6:30 a.m. to 7 o'clock. Let's pray. Wednesdays, 7 p.m. Healing, Health and Restoration Prayer Service. Thursday at 6 a.m. to 6:30 a.m. Let's get walking. Saturdays at 5:30 a.m. to 9 a.m. Early Morning Health. Saturdays at 9 a.m. to 10 a.m. Church at Study. Saturdays at 10 a.m. Saturday services. Saturdays at 5 p.m. Extending Your Life Naturally. Sundays at 5:30 p.m. Bible Study. For more information, contact us at 516-777-0868 or email us at hondortministry@gmail.com.
Thank you, Tech Team. It's my pleasure and it's an honor to introduce our speaker to you today. Our speaker is Dr. Kathy Dennis Yawingu, who is a medical doctor. And today she will be presenting on the topic, Fighting Arthritis with Food. Dr. Kathy is a distinguished triple board certified physician in internal medicine, rheumatology, and lifestyle medicine. She is the founder and lead clinician of her independent practice in Bloomfield, Connecticut, where she is committed to a whole person approach to care. Her clinical philosophy centers on identifying and addressing the root causes of disease, empowering patients to experience sustainable healing and optimal wellness. Dr. Kathy completed her medical degree at Upstate Medical University in Syracuse, New York. She went on to complete her internal medicine residency at Winthrop University Hospital in Long Island, followed by a rheumatology fellowship at the University of Pennsylvania. With more than 2 decades of medical experience, she continues to blend scientific excellence with compassionate, patient-centered care. A dedicated advocate for community health, Dr. Kathy is actively engaged in outreach within her region and beyond. Her passion for service has taken her to remote areas around the world as a missionary physician. While volunteering in the Solomon Islands, she met her husband, Dr. Max Yawingu. They have been married for 20 years and are the proud parents of 4 sons. Together, their family regularly participates in mission-driven initiatives, from supporting the homeless in downtown Hartford to serving communities within the Navajo Nation. Service is a defining value of her family life. Dr. Kathy is deeply committed to the transformative impact of lifestyle medicine. She's a sought-after speaker and educator, sharing evidence-based principles that support God's design for holistic well-being, body, mind, and spirit. Through her growing digital platform, she equips individuals and families to make healthier choices, one step and one plate at a time. Her work can be followed at www.arcwellness.health, and she can be found on social media at Wellness Dr. Kathy. In her personal time, Dr. Kathy enjoys preparing plant-based meals, running outdoors, reading, and exploring new places with her family. So without further ado, I present to you Dr. Kathy Yawingu.
Thank you, Dr. Ephraim. Thank you for that awesome introduction. All right, well, good evening, everyone. I am so delighted to be here with you tonight, and I'm glad that you are here as we are going to speak together on fighting arthritis with food. I am just going to get you the right presentation here. Awesome. All right. So fighting arthritis with food. So as Dr. Ephraim told you, I am a board-certified rheumatologist, which means I specialize in diagnosing and treating arthritis and diffuse body pain and inflammation. The whole notion of fighting arthritis has been fighting disease with food has been well accepted for diseases like diabetes and obesity, as well as high cholesterol. Many people accept the fact that we can reverse those things with food. But when it comes to arthritis, that's not a very common commonly accepted notion. And so that's why it's so important to me to share the fact that, yes, we can fight arthritis with food. I've seen it many times in multiple patients. There is literature that supports it, and I've experienced it in my own life with my journey of arthritis. So I'm excited to share that with you this afternoon. Now, I'd like to start by breaking down the word arthritis. That word comes from the Greek. The first part is from the word arthron, which means joint. And the second part, itis, means inflammation. So arthritis put together means joint inflammation. The joint is where two bones meet and articulate. And so there's inflammation between those two bones. Now, I have a question for you all. How many types of arthritis do you think there are? Put it in the chat. How many types of arthritis do you think there are? I wish I could see the chat from my standpoint here, but I can't multitask and do so many different things. So I'm going to tell you how many different types of arthritis there are. There are over 100 different types of arthritic conditions. I don't know if anybody got that in the chat, but there are a lot of different types of arthritis based on where it's located and what's actually causing it. And as a rheumatologist, what I do is try to differentiate inflammatory from mechanical, so I can determine the etiology and decide the best treatment. Now, of those 100 types of arthritis, the most common ones are these two here. And most of you have heard of osteoarthritis. That's the most common form of arthritis. It results from wear and tear, the wearing away of cartilage over time. It's like the tires on a car. When you have tires on a car and you've driven for thousands of miles, the tires begin to thin out. And that's what happens in osteoarthritis. The cartilage begins to thin out. And so the cushioning between the joints is not so significant. That usually begins around the 40s, and it mostly affects the knees, lower back, and hips. Now, rheumatoid arthritis is a different kind of condition. This is an inflammatory arthritis where your immune system is looking at your joint as a foreign entity. And this is usually in females. It begins earlier in life, usually 20s, 30s, 40s, around that age range. And the presentation is symmetrical swelling and stiffness. That is how this disease presents. Now, when it comes to treating arthritis, we know for a fact that lifestyle changes can make a big difference. Exercise and dietary changes can help, and that's even supported in the European arthritis recommendations, the EULAR recommendations. But many times that's overlooked, and we jump to other treatments right away, like medications. The most common medications that you've heard of and that we know can help would include NSAIDs. Those are non-steroidal anti-inflammatory drugs. Those can be quite effective to treat pain and inflammation, but they come with side effects, and we have to be so careful of them. These NSAIDs are drugs that you're familiar with, like Aleve, ibuprofen, Relafin. These particular drugs, the side effects can include things like heartburn, stomach ulcers, leg swelling, elevated blood pressure. So we have to be so careful with these drugs, especially with long-term use. Steroids are another common treatment for arthritis, and this is the wonder drug. Whenever I give a patient steroids, I become their best friend initially because they feel great. But after a little while, I become their worst enemy when they can't get off it because of the side effects, the weight gain, the moodiness, the increased appetite, increased infection risk, yeast. They just don't like it anymore. And so steroids, yes, they can help, but the side effects are something that we have to always deal with. Physical therapy is also useful to treat arthritis because it improves mobility and strength, which in the long run helps to slow down disease progression and helps to manage pain. But I like to remind my patients that physical therapy is for a limited amount of time. When therapy is done, you need to continue the exercises well beyond that so you can maintain the gains from the therapy. You can maintain the strength and the stability. So exercises need to be continually done. Surgery can be an option, especially when you're at end stage arthritis, bone on bone, limited mobility. Surgery sometimes is very useful and can improve the quality of life. So what connection does food have with arthritis? Well, the connection really is inflammation. Diet plays a crucial role because we know that certain foods can increase inflammation and certain foods can turn it down. And remember, arthritis is really inflammation between two joints, between two bones. And if we can modulate the inflammation, we can make a big difference. And that's why food plays a big role. So what is
excuse me, we're not seeing your slides.
You're not seeing the slides. Okay, let's see here. Let me go back to Zoom. And let me try to share again. Did the slides just disappear? Or you haven't seen any slides at all?
None at all.
None at all. Just your face.
I text you, but I text you privately to let you know, but you didn't see that.
Okay, all right, no problem. Let me share them again. All right, so un momento. All right. One second here. I'm gonna get this working for you. And show, all right. All right, so I'm gonna share. Let's click on that and share. All right, can you see it now?
Yes, we can. Can you just maximize to presentation mode?
Yep, let me go into presentation mode here. All right. Can you still see it?
Yes.
Okay, awesome. All right, thank you. All right, so we were at inflammation. All right, so what is inflammation? Inflammation is derived from the Latin term inflammatio, which means a setting on fire. It's a natural response by the body to deal with injury, infection, or harmful exposures. This fire is not always a bad thing. Where my husband is from Papua New Guinea, and in their culture, fire is very central to community bonding. There's always a big fire going on in the middle of the compound outside, and that's where they meet to tell stories, to share experiences, and to pass down traditions. And even in our own home now, my husband always has a fire going. Either there's a fire going in the wood stove in the family room, or there's a fire going on outside in the fire pit in the backyard. But fire can give warmth, bring folks together, and be a good thing. But if that fire were to get out of the boundaries, out of the fire pit and the wood stove, and burn the house, that would be a problem. And it's the same thing with inflammation. Inflammation is not bad by itself. It's there to protect us. It's there to fight foreign things, to fight invading viruses, fungus. But when it gets out of control and doesn't stop, that's when we have a problem. And in this schematic here, you can see that there's a blood vessel here, and there is a response to a toxin. Something has entered the skin. And with that entry, you see white cells are going through the vessel wall and releasing cytokines and releasing various lysosomes to attack the foreign agent. And the inflammation causes swelling, redness, tenderness, pain, and that's a sign of inflammation there. So acute inflammation is short-lived, usually hours to days. When you got that virus, if you got a bug recently and you felt feverish and your body was in pain, that was inflammation fighting that invader. But over time, you killed the bug and you healed. And so it leads to repair of damaged tissues and it fights infection. That's acute. Chronic inflammation, though, is when it's long-term, lasting months to years. This kind of inflammation causes harm to tissues and organs. The symptoms could be as subtle as just this lingering fatigue, or just chronic pain with no clear explanation, or low-grade fever. These tend to be autoimmune conditions, or for example, like rheumatoid, lupus, or other illnesses that are not well controlled over time. Now, what are some causes of chronic inflammation? Well, some of the causes would be environmental factors like pollution, smoking, exposure to toxins. We know that smoking is a really major factor for multiple diseases, especially for rheumatoid arthritis. There's clear studies that link the toxins in smoke to the increased risk of rheumatoid arthritis. Also, chronic inflammation can be caused by persistent infections like hepatitis or chronic gum disease. Many people don't realize that when we have chronic gum disease, that can be the first entryway to infection inside the bloodstream, which triggers the immune system, which then leads to an autoimmune chronic illness. And so if you're brushing and you find that your gums bleed easily, that is a problem. That's a sign of gum disease, and you need to get that fixed. A simple way to address that would be to floss on a regular basis to decrease the risk of infection. Other causes of chronic inflammation are lifestyle factors. A poor diet is a big risk factor for chronic inflammation. A diet that's high in processed sugar, refined carbs, and trans fats. Now, it's important to just note that the majority of the immune system is in the gut. And so what the gut experiences when it comes to its exposure to food, harmful food, and foods that trigger inflammation, it's important because that will activate the immune system and cause long-term inflammatory effects. So, pro-inflammatory foods can trigger or worsen infection. How does it do that? By activating the immune system, increasing oxidative stress, and leading to gut dysbiosis. Gut dysbiosis is the imbalance and the improper interaction of your good and your bad bacteria. So what foods then should we avoid if we want to decrease inflammation and decrease the risk of arthritis? Well, the first food you want to avoid is refined sugars, refined and processed sugars. Refined sugars lead to high sugar levels in the blood, which elevate your insulin, and prolonged elevated insulin activates MAP kinase, stimulates NF-kappa B, and releases inflammatory cytokines like IL-6 and TNF-alpha. When these cytokines are gone array, you feel it in your joints and disease follows. High blood sugar levels also lead to the formation of advanced glycation end products. And when those attach to cartilage, that can damage cartilage and lead to progressive arthritis. And it's interesting, some of you may be aware that the government just released new dietary guidelines for the country. And one of the big changes in the guidelines for this 5 years compared to the prior 5 years is that they're recommending that we avoid processed sugars. So that's the first food to avoid, processed sugars. The second food to avoid would be processed meats. Processed meats are like your sliced, your deli meats, those sausages, bacon, those turkey sliced up things you get in the deli section. Those are bad news. The WHO has classified those meats as class 1 carcinogenic. They have been clearly linked to the increased risk of cancer. And so that's definitely a reason you should avoid them. But also the additives and preservatives lead to gut dysbiosis. They disrupt gut health and increase arthritis symptoms and worsen inflammation. So we want to avoid processed sugars, avoid processed meats, and we want to avoid trans fats. Now, thank God, trans fats have been officially banned since 2018, around there. But unfortunately, trans fats, even though they've been banned, they still exist in foods. And I'm going to tell you what foods that they're in and how to be aware of them. Trans fats are bad because they are partially hydrogenated oils that interfere with the cell membrane function. Now, your cell membrane is extremely important. That's like the barrier, the protection of your cell. It's the cell wall. If your cell wall is not functioning well, then your cell activity is also going to be affected. And they also lead to increased inflammatory gene switching, like turning up TNF alpha, IL-6, and C-reactive protein. Now, where can you find trans fats? And why do you still have trans fats? Well, even though in 2018, the FDA banned artificial trans fats from most foods, they left a loophole. They said if something contains less than 0.5 grams per serving, you can just round it down to 0 and say it has no trans fats. And that's not entirely accurate, because as we eat more of these foods with these small amounts of trans fats, it adds up and it damages our cell wall and increases inflammation. So where can you find this hidden trans fat? Well, in our baked goods like cookies, pies, pastries, in non-dairy creamers, microwave popcorn is a big one, fried fast food, shortenings, margarine, and imported packaged goods that come from other countries where trans fats are still allowed. So we want to avoid processed sugar, processed meats, trans fats, and highly processed foods. Highly processed foods, ultra processed foods are really, really bad. These are foods that are like packaged snacks, instant noodles. They have additives, preservatives, emulsifiers that completely disrupt the gut microbiome and the immune response. So we want to be so careful about those foods. Also, alcohol. Alcohol is a no-no. At first, we were advised that a little bit of alcohol, a little bit of wine every day is good for heart health. Now we know that's not the case. Alcohol is a toxin, and it damages every cell in your body. It damages your gut lining, it promotes endotoxin leakage, and it increases the inflammatory response. If you want an anti-inflammatory effect that we thought we got from alcohol, like wine, you'd be better off having grape juice or grapes with the resveratrol. But alcohol, just straight up alcohol, is a toxin, and there is no safe level, and it affects even arthritis patients. So I hope you're following along with the foods that we are trying to avoid and not losing track. Processed sugar, added sugar, processed meats, your trans fats, your processed foods, and your alcohol. You want to avoid these. Now, dairy can promote inflammation, and we have to be careful. Dairy is advertised as a health food, But in many individuals, it does not go down well, and it promotes inflammation in many different ways. But one of them is casein. Casein is the main protein in dairy, and it can be quite pro-inflammatory, especially in sensitive individuals. Casein stimulates a leaky gut, which can be the underlying problem in many autoimmune diseases. We found through research that the type of casein found in American cows is even more inflammatory. They have A1 casein, whereas European cows have A2 casein. European cows and also other animals like goat and sheep, they have A2 casein, which is not as inflammatory as the A1 casein. And so these differences can be subtle, but when you're struggling with disease and inflammation, you really want to be well informed so that you know what potentially could be making you not feel so great. It appears that molecular mimicry can play a big role when it comes to dairy, because some of the proteins that we find in dairy foods are similar to the proteins in human joints. And so many times when the immune system is attacking the protein in dairy and making antibodies to it, those same antibodies can attack our joints. And now we have inflammation because there was a missed signal from the introduction of dairy. This is called molecular mimicry. And if we eliminate dairy, sometimes we can eliminate the problem. The gut microbiome is also disturbed by other additives or other things in dairy. For example, antibiotic residues and hormones really disrupt the gut microbiome, and this leads to systemic inflammation and worsened autoimmune conditions. So in summary, what is the worst diet for arthritis? It's a Western, processed, and refined diet. The standard American diet, or the SAD diet, which is high in processed carbs, sugar, animal protein, fried food, dairy, chemicals, and preservatives. And that really is making us quite sick and giving us more joint pain and more arthritis. So you may be saying, oh my goodness, that's my entire diet. What am I going to eat? Well, we're going to talk about the best diet for arthritis, and that is a whole food, plant predominant or plant-based diet, which is rich in fruits, vegetables, legumes, whole grains, and omega-3 rich fats. A whole food plant-based diet for arthritis. So I'm going to start off by talking a little bit about omega-3 because we have a lot of evidence and research that points to the fact that omega-3 can be quite anti-inflammatory. It does this by reducing the production of inflammatory prostaglandins and cytokines. It also gets converted to resolvins, which actively resolve inflammation. And there are quite a few studies on rheumatoid patients that showed that the higher their level of omega-3 intake, the lower their CRP, which is a marker of inflammation, and the lower their interleukin-6. So we know that omega-3 is potentially quite beneficial in inflammatory arthritis, especially. So where do we get omega-3 from? Well, when folks think of omega-3, they think of fish. And whilst fish is a source of omega-3, it's important to note that fish does not make omega-3. Like fish don't make it inherently. They get it from microalgae. They eat it. And when you eat fish is not like a superfood like many people think. They think, oh, I want to be healthy, so I'm going to eat fish. And so I want to clear up any myths that folks may have, because I want you to have proper information so you can make the best choices for your information and for your health. So fish is not a superfood. When you eat fish thinking that you get omega-3, you have to realize that it matters where you get the fish from and how you prepare it and how much you eat. So if you get fish from farm-fed fish, they have very little EPA, DHA, a type of omega-3, and which is a kind that is helping us with inflammation. And so if you're eating farm-fed or farm-raised fish, you're not getting much omega-3. If you fry your fish, you're obliterating the health benefits that you think that you're getting from the fish. And when you eat fish, you can't really gauge how much EPA, DHA, which is omega-3, that you're getting. You can't quantify it well. It's important to note too that fish in their flesh, they retain a lot of environmental toxins. So they retain mercury, dioxins, they retain the surrounding toxins in the environment. And when we eat that, we in turn get that deposited within our cells. And so when you have an autoimmune condition and you're trying to fight environmental toxins, we don't want to necessarily be eating too many environmental toxins. So fish may not be the best source of omega-3. Plants provide omega-3, and plant sources of omega-3 include chia seeds, flaxseed, walnut, and hemp seed. But in full disclosure, I have to let you know that these foods contain ALA, alpha-linoleic acid, which is the precursor to the active form of the omega-3 you want. So there are three types of omega-3. There's ALA, which is a precursor or the building block. There's EPA and DHA, which are the active form. So we want more EPA and DHA to fight inflammation. That's the part that fights the disease. And so when we eat chia seeds, flax seeds, walnuts, hemp seeds, we're getting ALA, which we then have to convert to EPA, DHA. Many people can do that, the conversion, but some people can't. People who can't usually are people who, as they get older, they may not convert it as well. Or people who eat lots of processed foods can't convert it as well. Why is that? Because processed foods are high in omega-6, which inhibit the enzyme which converts ALA to EPA, DHA. So when you eat these plant sources of omega-3, if you eat lots of processed foods with it, you may not convert the ALA to EPA, DHA well. Also, if you have other chronic illnesses like insulin resistance, diabetes, these individuals don't always convert ALA to EPA, DHA. So stay with me here, please. I'm giving you an alphabet soup, but I'm trying to make it simple and practical for you. Because it's important to understand, it really is, when we're trying to take care of our health and prevent disease. So yes, I think plant sources are a great source of omega-3, and I believe that we should eat flax seeds, chia seeds, walnuts, and hemp seeds every day. But you need to also decrease your ultra-processed foods and consider adding something like a plant source algae-based omega-3, because that has pure EPA, DHA, and you know exactly how much you're getting. It's usually recommended that if you're taking algae-based omega-3, you get about 200 to 300 milligrams per day. You can have it in liquid or in a capsule, either way you want. That is getting it directly from the microalgae or microalgae, and then you know exactly how much EPA, DHA. This is a very important point for a fully plant-based eater, a very important point. And if you're fully plant-based, you don't have any animal products, you need to understand this concept very well and know how to properly replace any EPA, DHA that you need. You can also get it tested. They have omega-3 testing, blood test now, so you can check if you are converting well and if you have enough EPA, DHA. Why is this so important? Because, and this is a little off topic, the latest Adventist health study showed that fully plant-based eaters, even though they had a lower risk overall of chronic diseases throughout their lifetime, when they got to a later age, about 80s, 70s, 80s, they had a little uptick of Parkinson's, dementia, and stroke, and it's still not clear what that could be from. The thought is maybe there's some missing pieces like B12 and omega-3, and so I want all my fully plant-based eaters to be very aware of this so they can properly supplement. All right, so comparing fish oil versus algae oil, I hope you got what I was trying to say. They both can give you EPA, DHA, but when it comes to fish sources, the fish is not making it, it's getting it from microalgae. If you take microalgae directly, you're getting the EPA, DHA. Dosing is very inconsistent in fish. You have no idea how much you're getting. It's very consistent if you take the algae-derived omega-3. There are contaminants in fish like mercury and PCBs. You'll have to be very careful of that, especially if you are sick. If you are sick, you don't want to have foods with toxins in them. Algae-derived omega-3 don't have that. So things for us to keep in mind. All right, so we spoke about omega-3. You're beginning to think about it more and try to make sure that you're on the right track with that. What else do you need to eat for fighting arthritis? Fruits and vegetables. Extremely important. Fruits and vegetables have antioxidants, which decrease inflammation. They decrease this through vitamin C, carotenoids, flavonoids. They also have anthocyanins, which decrease inflammation. You find these in berries, strawberries, blueberries, cherries. And vitamin C not only decreases inflammation, but it helps with collagen formation and helps to repair cartilage. So fruits and vegetables are super important. Cruciferous vegetables in their own class. You need to be eating these every single day. A cup of broccoli or cauliflower or kale or Brussels sprouts. These are real superfoods here. They help to break down, they break down into sulforaphane. They help with detoxification, which decreases inflammation and fights against cancer. They are high in fiber, which helps to clean the gut and feed the gut microbiome. And they're very high in vitamin K, which helps with healing, repair, with absorbing vitamin D, and they help with phytonutrients. I don't know how many of you are aware that the WHO recommends that children should be having 5 servings of fruits and vegetables every day. Women should have 7 servings of fruits and vegetables every day. And men should have 9 servings of fruits and vegetables every day. A serving is a cup. Now I want you to think, am I having that much fruits and vegetables every day? That's what we need to maintain health. If we're fighting disease, we need even more. And so we need to be very mindful, especially when trying to fight arthritis, that we increase our intake of fruits and vegetables and that we eat the rainbow to get a broad mix of antioxidants. Whole grains. Whole grains are still a superfood, despite what came out in the recent government dietary recommendations. Whole foods have a long track record of fighting inflammation, fighting disease, decreasing cancer, and on a whole, lowering CRP, which is an inflammatory marker that the liver produces. Whole grains. So I think many people, when they think of reducing carbs, they're not getting the fact that the bad carbs are the processed carbs. Good carbs are whole carbs, whole foods. These are foods we need to include in our diet. Sweet potatoes, whole brown rice, quinoa, oats, amaranth. These whole foods fight disease. These whole food carbs are very healthy. It's the carbs that have removed their outer layer, their coating, the carbs that are refined and processed. Those are the bad guys. Your white flour, your crackers, your cookies, your cakes, anything that has white flour, white rice. Those are your refined carbs, your pastas, your refined white pastas. Those are the bad guys, not your whole grains. These are very important. It's also important to soak our grains to remove phytic acid, because when you remove the phytic acid, this will help you with absorption of your nutrients. So it's important to soak our grains. Beans are another superfood that we don't want to be without. We should have a cup of beans every day, either a cup of beans, lentils, every day. These are foods that are known throughout the world to fight inflammation. Why? Because they're high in fiber. And not just fiber, they have minerals like magnesium, iron, zinc, and especially the soy, which has isoflavones, are very anti-inflammatory. If you currently eat meat every day, it may be a great idea to swap a few days a week with beans or lentils, so that you don't have to eat meat every day, because beans are excellent source of protein and fiber as well as minerals, and they really do fight disease. To remove the oligosaccharides in beans, that's what causes people to get bloated and gassy. You would just soak your beans, or soak them and throw away the water, or you could use a pressure cooker. These days, I recommend that when you're cooking with beans, it's best to use a pressure cooker. Or nowadays, I call them an Instapot or Instapot variant, because at these high temperatures, you are killing the lectins and the oligosaccharides that are in the beans and removing anti-nutritive properties. Nuts and seeds are healthy food. They are monounsaturated and polyunsaturated fats, and they have omega-3. We spoke about that earlier. They help to reduce inflammatory cytokines like TNF alpha, interleukin 6. The vitamin E in our nuts and seeds help to protect our joints from oxidative damage. They have selenium and magnesium, which help immune regulation. Magnesium is the number one is the most deficient mineral in the American diet. And so we want to be mindful of getting magnesium in our daily foods. And so just a handful of nuts and seeds every day will go a very far way. So we went over the ideal diet to fight arthritis. It's a whole food, plant-based diet. And not only do we have the evidence to prove that in the literature, I have proven it in my own life. I come from a long line of arthritis. In my grandparents, my parents, my aunts, my uncles, lots of arthritis. And so when I first developed joint pain, when I was not a resident, I was an attending. I had just become an attending in a big university hospital. I developed arthritis in my wrist, and I had to be wearing a wrist brace to write my notes because the pain was so excruciating. I had pain in my back, which radiated to my legs, so I knew I had sciatica. I was like, great. And my knees hurt as I was doing rounding with the residents. I didn't want to get the stairs because my knees would hurt as I'd go up the stairs. And I was like, man, I'm an arthritis doctor, and now I have arthritis, and I don't know what to do because it was just really affecting my quality of life. And God would so have it that one day I got a call from a pastor, Leroy Daly. Many of you are familiar with him. And he said to me, he wanted me to join him on a journey, a dietary journey. He wanted me to do a Daniel's diet with him. And I had no clue what he was talking about. He explained to me that on a Daniel's diet, you're going to eat completely whole foods, nothing processed, nothing refined. I had to make my own everything, and I could only eat single ingredient foods. And so I said, okay, I could try it, why not? I'll do it with you. So I dived into this whole new world of eating. I mean, mind you, I was a vegetarian my entire life. Since I was 9 years old, I stopped eating meat. but I was a very processed vegetarian. I mean, I would eat pizza, but just tear off the cheese. So I was having the white, the white dough part and the marinara sauce with sugar added to it. I was having chips and pastries and cookies. I was just eating anything that didn't have animals in it but was processed, I would eat it. And so having to go on this Daniel's diet, I had to really reframe my whole thinking about food. I began to make my own nut milk from almonds and dates. I began making my own granola from scratch. I ate only brown rice and beans, and he also had me intermittent fasting, so I was only eating twice a day. And I realized that after eating that way, my joint pain went away. Like I didn't have to wear my wrist brace anymore. I could write my notes without pain. My back pain went away. My knees didn't hurt anymore. And I was like, really? Could the food have been causing my pain all this time? As a doctor, I never made the connection because nobody in the medical society made the connection. So it just didn't even dawn on me. But in my own life, I saw the difference. And then, a few years later, as I would try, as I would try different cultural foods, like a little black cake here, a little sorrel there, my joint pain came back. And I was like, yes, that's what it was. I could clearly correlate foods that caused me pain and when I didn't have to have pain. So a whole food plant-based diet is definitely a prescriptive recommendation for arthritis. And for some people, it may not be enough to completely resolve all the pain, but it can definitely take you far away. So whether you need some medication still, you may need less medications if you eat a whole food diet. And in some cases, you may be able to even get off of it. But that we know for sure from life case studies to studies that you can find in peer-reviewed journals, and I have the journals here, that show studies that confirm that diet does help with arthritis. We know the best diet is a whole food plant-based diet. And by God's grace, I pray that we can all be able to experience the relief that comes from following God's plan and the diet that he first prescribed in the Garden of Eden. Thank you for your time, and I'm open for any questions.
Okay, as we prepare for questions and answers, those of you who can put your questions in the chat. If not, you raise your hand. But before we go into the question and answer, I'm just going to make an appeal to let you know that we do accept donations. Tech team, if you could show that flyer so that persons can know how they can donate to us. We do accept donations, and these are the 3 ways that you can donate to the ministry. You could use Zelle, and it's hunnations7@gmail.com, or you could mail it to Healing of the Nations Virtual Ministry, and the P.O. Box is 1174, Valley Stream, New York. And the zip is 11582. Please do not put cash in the mail, okay? That would not be very safe, especially in today's world. So we want for you to know that we do accept donations. And again, we do have health consults that do consultations, and the number is provided as well. So we are now going to move into our question and answer segments. I will take questions from the chat, and then I will let someone unmute themselves and give their question. So I see we have a few questions here in the chat. Someone is asking if you said not to use an Instapot.
No, I recommend using a pressure cooker for beans and peas, like an Instapot. An Instapot is just an example of a pressure cooker, but they have different names on the market. But any type of pressure cooker, that is because at those high temperatures, you're able to remove some of the anti-nutritive anti-nutritive properties that are in beans and peas. For example, lectins, which can disrupt the gut microbiome or at least irritate it. And it will help remove some of the oligosaccharides that can cause bloating and indigestion and all that gassiness. So no, if you don't have one, then you would soak your beans, throw away the water, or you could sprout your beans. That's even better. It becomes even more nutritional, but an Instapot is great to have.
Okay. Okay, Tony, can you please unmute yourself and ask your question?
Yes. Thank you so much, Dr. Kathy.
You're
I
welcome.
appreciate your information. When it comes to algae, is that the only way that you can get EPA? And are you saying that you recommend an algae supplement? Can you say more about that?
Yes, so that's a great question. So omega-3, you have different forms of omega-3. You have ALA, EPA, and DHA. ALA is not the part that decreases inflammation. It gets converted to EPA and DHA. The sources of EPA and DHA are microalgae, not macroalgae like sea moss, microalgae. And those have EPA, DHA. Now, we are fine. So yes, I am recommending that either you check your omega levels and see if your ratio is good with your EPA, DHA, ALA. If you are converting well, then you're good to go. Because what should happen is when you eat the ALA in plants like your flaxseed, your chia seed, your walnuts, your hemp seeds, you get ALA, about 2.5 grams of ALA per tablespoon, and then it goes into your body and your elongase enzyme converts it to EPA, DHA. But it is not consistent in every single person. Some people, their enzyme doesn't work as well for various reasons. One could be the aging process. Two could be because they already have a diet that's high in processed foods, which are high in omega-6. And omega-6 limits how well this enzyme can convert ALA to EPA, DHA. So there are many factors that you are working with when doing the conversion process. So you may not be a good converter. And if that's the case, it would be good to take algae oil. You could take it in the form of oil or tablet. But yes, just like I would say to you, if you're a fully plant-based eater, and I would recommend that you take B12, and not just a plant-based eater. I have so many patients who eat meat who are B12 deficient. Why is that? Because you need appropriate stomach acid to absorb B12. And as you get older, one, you may not have as much acid, so you don't absorb the B12. Two, if you take a PPI or H2 blocker to decrease acid, you're not going to absorb B12 well. And so there are many, or if you take things like metformin, you're not going to absorb B12 well. So it's not just a plant-based eater who needs to be concerned about B12. The same thing with EPA, DHA. It's not just plant-based eaters who need to be concerned about omega-3, because you could be eating fish and not be getting appropriate levels of omega-3. So I think everybody should be looking into this, be aware of their B12 levels, be aware of their omega ratios in their body, and see if they are set with that. And the reason it's important is because DHA is important for brain function and for myelination. And if we're deficient in DHA, it affects our brain. You see this rampant growth of dementia and Alzheimer's? It's going out of control. And a big part of it is lifestyle. So and not just food, I mean, just lifestyle with decreased sleep, increased stress, but also the diet, highly processed foods, a lack of proper omega-3. These things affect our brain function, and later on, we find out that we have a problem. So yes, I would recommend that you get one, if you can, get your omega-3 levels checked, the ratios, and if you can't, just, consider adding algae supplementation, and take flax seeds and chia seeds every day. 2 tablespoons of flaxseed, up 2 to 4 tablespoons of flaxseed, depending on whatever your medical condition might be, but at least 2 tablespoons for the average person.
Thanks so much. That's a very comprehensive answer. I use those seeds as my salad dressing. Is that okay?
That is awesome. That's awesome.
Okay.
Definitely get them in every day. Certain things that you should get every day are your 7 cups of fruits and vegetables, your 1 cup of beans, your 2 tablespoons of flaxseed, and at least those. And yeah, I would say those are the ones that I would say every day, get those in.
Thanks
Okay,
so much,
Abigail.
Doc. Thank you.
You're welcome.
Abigail is asking in the chat, I was told to eat a handful of nuts once a week to get cholesterol down. How true is this?
So nuts have unsaturated fats, and they have fiber. And so anything with fiber can definitely help with our cholesterol. But I would say that when it comes to cholesterol, the nuts are helpful, not more than a handful, right? Not more than a handful. When we have more, nuts are such a nutrient dense food that when you have more than a handful of nuts, you get more calories and you put on more weight. So you want to be careful. If you want to put on weight as a plant-based eater, definitely go for 2 to 3 handfuls of nuts, because some plant-based eaters, they struggle with keeping weight on, and that's where you increase their calories, and nuts are very helpful with that. But yes, nuts are fine, but it's not just nuts. You really want to look at a pattern of eating, not just one superfood. A pattern of eating, which is a whole food, plant-based diet, eating that way consistently, and aiming for 40 grams, at least 40 grams of fiber every day. I ask my patients to calculate how many grams of fiber they're having, and all you have to do is just go on the internet, go on ChatGPT, and just say what you had today. I had a bowl of oatmeal, I had 1 apple, I had a bowl of pasta, I had 1 cup of salad, I had, how many grams of fiber did I have? And it will say, oh, it looks like you had 10 grams of fiber. Then I have a problem. I need to increase my fiber, and then you can start to play around with your diet. You can, add some more flax seeds or add some more salad, but you need to aim for at least 40 grams of fiber every day, and that will pull your cholesterol down.
And I would even say the handful of nuts. I know the Brazil nuts work very well with the cholesterol, 3 Brazil nuts per day. I've actually, seen someone did that and was able to bring the cholesterol and the triglycerides down. So, yeah. Okay. Cordelia, can you please unmute and ask your question?
Good evening, everyone. I'm so sorry I came in somewhat a bit late. I'd have to go back and watch it on YouTube, but I'm age 50 and I'm having a situation. I've been diagnosed about 4 to 5 years now with rheumatoid arthritis, PCOS, and for some reason, taking the doctor's medication, I recognize that I've been having very heavy bleeding because I was on steroids, which is the prednisone. However, after being sent to do some tests, I've been found to have large fibroids and a cyst. But I'm now at a point where I am unable to walk. And I've changed my diet because I've been watching some programs. I'm using like the flaxseed, as you mentioned, the chia seed, the sea moss. I've been taking the B12. I used to feel very energized and moving around and doing activities. But despite taking all of the B12, the magnesium, the calcium, I was told that my body wasn't processing the calcium, so I was suggested to take the D3 plus K2 along with it. But even doing all of those things now, I am still having tremendous pains in the joints to the point where I'm unable to move around. So I'm not even sure. They also said I had some amount of fat on the liver in the test that was done. So I'm kind of suggesting this, asking for some guidance as to where I may be. You mentioned 2 tablespoons to 4 of flaxseed. I'm thinking maybe I need to have more because I was only having the flaxseed once per day, 1 tablespoon. So, and 1 teaspoon of the chia seeds. So I'm seeing where I maybe need to increase that.
Mm-hmm. So, I'm sorry to hear about your arthritis getting worse. That is no fun. Are you still working with your doctor?
Yes, I am still working with my doctor, but I have refrained from taking the medications because I'm not getting any improvement, and I've been complaining, and they just keep saying, take the medication, take the medication. The blood pressure was very high, 100 and 200 and something, over 100 and something. It wasn't going down, and then I started using the CMOS and also the salan I forgot the name of it. The French time they call it here in Jamaica. Right. I use it in my green juice and stuff like that. And I recognize that the pressure and had gone down. I also dry the moringa, blend it up in it and use it, and the pressure went down without taking the medication. Because what happened when I was taking the medication, my heart felt like it wanted to jump out through my chest. It was
Yeah.
racing really bad.
Yeah. So, definitely keep working with your doctor because sometimes they may have different options. If you are persistent and let them know what your symptoms are, things that you can do in conjunction with your doctor would be, I can tell you that there's lots of research that shows that a brief period of fasting has been shown to help with rheumatoid arthritis, especially. Fasting meaning light broths, just light vegetable broths and very low calorie eating. So light vegetable broths, very lightly, few steamed vegetables, and having that for maybe 3-4 days or 2 to 3 days, that can help reduce pain acutely. And then when it comes to getting back into food, just a very, very unprocessed, unrefined diet with high amounts of vegetables. Being that somebody who has rheumatoid arthritis should be having at least 9 to 10 cups of fruits and vegetables every day, every single day. Things that help with pain, like curcumin is very helpful with pain, and about 2,000 to 3,000 milligrams of curcumin a day. We know that ginger is helpful with pain and inflammation. So you can get ginger tablets or you can add ginger to your foods. Very high doses of omega-3. Definitely the algae oil would be important because you would know for sure how much omega-3 you're getting, that you're getting EPA, DHA. So, and looking at the gut microbiome, rheumatoid arthritis patients have a very disturbed gut microbiome. It all starts in the gut. And so the gut has to be healed. And many times we have to heal the gut with things like slippery elm, aloe vera, marshmallow. So you can't ignore that the gut has to be healed. So just trying to put it together in a quick package for you. I want things to consider with active rheumatoid: a period of fasting with just light broths, teas, maybe very few steamed vegetables, but no hard food. When the body fasts, it can detox and fight inflammation better. Then after those 3 days of fasting, adding in curcumin, ginger, algae oil, high doses of omega-3, and a whole food diet. I mean, no processed food, not even one crackers is very important.
Thank you so very much, Miss.
You're welcome. And this platform has lifestyle coaches that work with individuals who have chronic illnesses, and I also do telehealth, and I can see people from anywhere by telehealth. And I don't know, Dr. Ephraim, if you gave my office information, but we should put it in the chat. My office number, my office website, www.arcwellness.health, and
Okay,
my office number, 860
okay,
833. I'll put it in here, office,
okay.
because
So
I often see people by telehealth also for arthritis and lifestyle conditions.
okay,
838.
and lastly, sorry, please, before I forget, I was just trying to remember where I also suffered severe anemia, always tired, always sleepy, lack of energy, all of that. Taking the iron supplements, I tend to have a lot of constipation. So I have to be having a lot of fiber in order to relieve me of that constipation. But in spite of the iron that I'm having, it still appears as though my iron is still low because I'm not gaining that getting rid of that fatigue and stuff like that.
So 2 points when it comes to anemia and low iron. One is that, yes, the type of iron that you take can cause constipation. So iron sulfate is a big culprit. So you want to switch to the type of iron that is not constipating. Iron, gluconate, iron. There are different formulations that are not constipating. The one that I recommend for my patients is Floradix. Floradix is a herbal iron that I give them with 1,000 milligrams of vitamin C. The vitamin C is vital because you will not absorb iron without vitamin C. So I give them both of them, and I've seen many cases where the iron comes back up over time. So that's important.
Thanks for the information. I'll try to make contact by the information sent out. Thanks much.
You're welcome. I see a question here about genetically modified foods like oats and corn. So yes, we don't want to have GMO food, and the foods that tend to be more genetically modified are the foods that are used in processed food. So some folks say, well, soy is bad, but soy is not bad. Soy is very anti-inflammatory, but you don't want to get GMO soy. And so the soy that is in the soy, the corn, the oats, the ones that are a part of the whole processed food industry, the ones that they use to make their chips and their granola bars and all their processed foods, those are your more GMO foods. That's where you'll find more of the GMO types. And so you can get corn and oats and so that's non-GMO and that you should tolerate fine. Granted, some people have food sensitivities and they can't tolerate, they can't tolerate corn and oats. But the average person may not have that sensitivity, but should still have non-GMO. I definitely agree. I do not want GMO foods, but it tends to be more in foods that are used in processed products, like in your fast food and your packaged snacks. Those are the more GMO foods. Curcumin, better to take than turmeric. Curcumin is just the active part. It's from turmeric. It's just the more medicinal part. So that's the part that we use for medicine. How do you advise on consuming?
We have a question here from Angelo. Sign, can you please define oxidative stress in a capsule and give an example?
Yeah, so within the body, we have enzymatic reactions happening all the time. Like enzymes are the workers and they're in the cell doing their job. And as they're working, there are byproducts of their work. Like it's like the waste. Like every time everything that you make, there's a byproduct. So that's the oxidative stress. And that can increase with certain foods like fried foods and fast foods. Those give you even more oxidative stress. And that's why it's so important for us to take foods that can bind up those lead to free radicals. So when you eat foods that can bind up those free radicals, like antioxidants, then it helps with the overall oxidative stress burden. But that's really a byproduct of just of reactions within the body. It's a way to clear, it's just junk from reactions.
Okay. We have another question here from Sharon Roberts. She's asking, is there a correlation with magnesium and mental health?
A correlation. So magnesium is a very important element in many enzymatic processes. And so if somebody has low magnesium, yes, that would affect. Whenever there's a nutrient deficiency, it comes up in different forms in the body. And that's why it's so important to try to have a nutrient-rich diet. Because when we're deficient in one nutrient, it affects how other nutrients can work in their realm and affects us. It manifests mentally or physically or emotionally. And so, yes, low magnesium would definitely cause mental issues, but so would many nutrient deficiencies. So we have to be very mindful.
Exactly, because we
Of covering
affected
our
the
nutrient base.
bioavailability and the synergy and everything.
Mm-hmm.
Things will go out of.
Yes, yes.
Someone is asking about nightshades, vegetables and arthritis. What's the relationship?
Nightshades, of course. How can you talk about arthritis and not talk about nightshades? So, what are nightshades? So, the nightshades are a group of foods that are believed to affect arthritis symptoms. And those are tomatoes, eggplants, potatoes with the little bit of green on them, and peppers like bell peppers and chili and paprika. And so the thought is that these foods have something called an alkaloid in there called solanine. And the thought is that individuals who are sensitive to solanine will have worsening of their arthritis. So I can tell you that there's not a lot of evidence to show that these foods worsen arthritis. It's more anecdotal. A lot of folks may say, well, mine got better when I stopped tomatoes, or mine is worse when I eat bell peppers. And so what I tell patients is, okay, we don't know for a fact that nightshades will make you worse, but if we've tried X, Y, and Z and you're still not better, we can do an elimination diet where you remove these foods for 2 to 3 weeks, and then you reintroduce them one by one to see if you get worse. And that's always something that is reasonable if you're not sure if you're reacting to the foods. And so that's the nightshade story in a nutshell.
Okay. Person's asking if they can use a crock pot or a slow cooker with the beans.
That's a great question. So apparently a crock pot does not kill lectins. And apparently a crock pot can leach lead over time. So I was very disappointed to learn this because I lived by a crock pot, but I now have I now have a Instapot, so that's what I use. But no, apparently, so a crock pot will help with oligosaccharides. It will help decrease the sugars that cause bloating. But when you're talking about like the lectins that we believe can affect the gut microbiome and cause irritation, apparently a crock pot doesn't get to high enough temperatures to kill them. So that's what the evidence is saying, and so that's what I'm following for now.
Of course, and we're better off staying away from anything that's gonna leach lead or anything that's aluminum, because those things we know not healthy. And I think someone wants the name of the omega-3 again, which is the algae based omega-3. Now, someone is saying, I have been using a plant-based diet for many years. No processed foods, no alcohol, no juices, 100% plant-based diet. And I suffer with severe arthritis pain in both knees and lower back. Could it be from the fact that I am going to be 80 years this year? They want to know if it's from aging.
So, you know, certainly we know that as we age, the cartilage wears out like the tires on a car. But we rotate our tires to help with alignment, because when things are out of alignment, when the tires are out of alignment, they wear faster. So that translates in humans to mean that we need to not only work on our diet when it comes to arthritis, but also do muscle strengthening exercises, and exercises to increase stability and flexibility. So you're 80 years old now. Your diet you have removed bad foods from your diet. What I would want you to consider is how to help with the alignment process of your joints. So increasing the stability of your joints, maybe the right exercises, maybe the right bracing to help with the pain, knee brace, back brace, hand brace, whatever brace, help with the stability of the joint. That will help with the pain. And also, and also increasing the good foods, making sure you're getting your 7 or 9 cups of fruits and vegetables, and also adding spices that fight inflammation. So when it comes to osteoarthritis, glucosamine chondroitin can be very helpful. There is a new formulation that is helping now with arthritis pain, which includes boswellia and celery seed. The different things that you can use even with worn out joints to try to control pain. So don't throw in the towel. Don't throw in the towel. There's still hope. Yes, your cartilage is probably worn out a bit, but there are things that you can try to decrease the pain. So definitely the right exercises, considering glucosamine, and your curcumin, your ginger, and all of that.
Okay. Someone is asking if you could name some B12 foods.
B12 foods. Okay, so B12 is found in muscles. Your muscle has B12. Animals' muscles have B12. And in the guts, or guts, can make B12. But I don't recommend eating animals for B12. And so when it comes to plant, because it's plant, animal protein is hard for the body to process. It can affect the kidneys, and saturated fat affects diabetes. So I don't recommend. And then animals in this society are so sick with antibiotics and illness and sickness. So I don't recommend eating animals for B12. And when it comes to plant-based sources of B12, yes, you can get some from yeast flakes, some mushrooms. But if you are fully, and then fortified foods, but again, those will be processed foods, like your processed flakes. They add B12 to lots of milks and plant milks and cereals and bread. But if you're fully plant-based, unprocessed, unrefined, I would say take a sublingual B12, be on the safe side. Honestly, we need to cover those bases to be safe. So I would say take your B12, supplementation, and take your now I'm going to start taking algae oil. You know, I'm so big on this algae oil now because it was never a concern of mine until the Adventist Health Study came out with the latest findings. Have you guys reviewed the Adventist Health Study findings on HON recently? With the increased signal of dementia and Alzheimer's in plant-based eaters in their later years? Have you?
But I don't think it was visited here in HON.
Oh, okay. I think it's important on all our plant-based platforms to review that because we need to know how to take care of our health, not so that we're only healthy in our, or middle life, but also in our later years. We want to be fully vibrant and we don't want to be faced with these illnesses of dementia, Alzheimer's, Parkinson's, and we've been plant-based our whole lives. Like, why are we having that uptick now? So now I'm gonna start using that. I just started in the past few weeks taking my algae omega-3. I didn't used to until this study came out. So as we learn more, we have to kind of review the evidence, assess it, and then pivot as we are so moved. So that's what I'm doing now. I'm taking those both. I take my D, my B12, and my algae oil, and my multivitamin, and my curcumin every day.
Are you saying argan oil? ARGAN?
Oh, I'm sorry. Let me type it in the chat.
And you said sublingual B12? Like, what's a good one?
The sublingual B12, it just bypasses. You just put it under your tongue, so it bypasses your
right.
GI
But what's
tract.
a good brand? Does it matter which
Buried
brand?
Treasure has a good one.
Okay.
Yeah, and Buried Treasure is a reputable company. Also, some of the practitioner companies that I use are like Metagenics, Thorn, Pure, Solar Ray. There's a bunch of them, and I can type it in for you. All right, so that's the algae oil there. That's from
okay.
that's from micro algae, not macro. It makes a difference. Micro algae. Macroalgae is like your sea moss, which is high in iodine and lots of minerals, but it doesn't have a reliable source of EPA, DHA. Okay, and so some of the companies, so Dr. Ephraim said Buried Treasure, and then I use Solar Ray or Pure or Designs for Health. These are ones that are supposed to be more reputable. That's where I get mine from.
Thank you.
Put those in there. You're welcome.
I actually saw one of the algae-based omega-3 with D3 and K2.
Oh boy, everything in one pill.
So you get it all.
That's good.
I'm sorry, could you repeat that?
Huh?
Could you repeat that?
I was saying I saw the algae-based omega-3 also with D3 and K2.
By who?
I'm supposed to have it here in my notes, so I'll see if I can pick it up and share it as well.
You said it has B12 and D2?
Huh?
What did you say? It has
D3 and K2.
Oh, D3 and K2.
Yes.
Okay.
Someone was asking me about the Adventist Health Study. So the Adventist Health Study has been going on for decades now. It's a large nutritional study tracking the diet of Adventists. And we've been able to find a lot of solid research showing that individuals who eat very, very little animal food, they have a lower rate of chronic diseases, like a much lower rate of diabetes, obesity, hypertension, heart disease. which was completely ignored by the government when they made these recommendations just last week for our new dietary guidelines. If you haven't seen those dietary guidelines, you should look out for them. Our new dietary guidelines for America are a lot more meat, a lot more full-fat dairy, and almost no grains. Like that's what they're recommending now for America. And that is not based on science. When you look at the Adventist Health Study, you see that individuals who eat mostly plants and very little animal products, they are able to avoid many chronic lifestyle diseases. And if you Google Adventist Health Study, you'll see all the different findings that they've published. But the most recent publication, their most recent update, as they've been following people over the years, has found that when they get to their 70s and 80s, they've noticed a slight increase. It's not huge, but it's an increase in the rate of dementia and Parkinson's and even stroke. In those same patients who had a very low rate of diabetes and hypertension when they were in their 50s and 60s, now they're 70 and 80 and they have a higher rate of dementia. So why is that? And that's something that we have to look into so that we can appropriately address it, as because we know eating plants is God's design. So what exactly do we need to fix so that we, can avoid problems when we get to 80 years old?
Mm-hmm.
And so some of the assumptions or some of the guesses are, well, could it be a lack of EPA, DHA? Could it be lack of B12? So what is it? Well, while we're thinking of it and trying to figure it out, I'm covering it. So that's yes.
Better safe than sorry.
Uh-huh.
And that's not something you want to experience. I've seen too many people, and I'm telling you, it's really a terrible illness to see persons go through that and deteriorate, no use to themselves, don't even recognize their own family. It's just, it's tough. It's really tough. Someone is asking, oh, well, that's personal, really. Someone wants to know if you're related to Dr. Karen Smart, if you're her sister.
She's my good friend.
I actually met Dr. Smart a few months back last year. Okay. I don't see any more questions in the chat.
I have a question. It was in the chat, but it's overlooked, I think.
Okay. Sorry.
Does for arthritis, do you recommend raw plant-based food or cooked? Or what percentage of cooked would you recommend for people who are having that arthritis to have compared to full raw?
Yeah, so I have observed individuals on eating raw foods. I've observed that they were able to eliminate their arthritis symptoms, but I've also observed individuals on cooked plant foods, as long as it's not processed, have the same outcome. So I would say that the main thing is to avoid processed and refined foods, to have at least your 7 to 9 servings of fruits and vegetables every day. Now, I see all kinds of patients. So I have to listen to their story and see where they're coming from and what they can do. If they are able to eat, let's say 70% or 80% raw and the rest cooked, that's fine. But some people that I'm seeing as patients, they can only, let's say, tolerate their broccoli and their Brussels sprouts and their cabbage cooked. I aim to increase the amount that they're eating, and so I'll have them increase their cooked amounts so they get to the ideal therapeutic dose of eating. So I don't really have a ratio that I say it has to be 80-20 or 50-50, but I do say it must be fully unprocessed, unrefined, whole foods. That's the key. With at least 7 to 9 servings of fruits and vegetables every day. They need to get, and a serving is a cup. Those are the keys for eliminating inflammation.
Thank you. Okay.
We have another question here in the chat. Someone is asking, what are your thoughts about ingesting black seed oil?
So I've reviewed the data on black seed oil, and what the data shows is that it can be useful concomitant with treatment. It may not be useful by itself. So I have added black seed oil to my patient protocol. You know, I do prescriptions, I do diets, I do pharmaceutical, I do different types of prescriptive therapy. So I add it to, let's say, my rheumatoid, and they have their panel of medications, and it's supposed to help decrease the amount of medicine that they need. But it's been shown to be useful for rheumatoid and osteoarthritis, so it can be useful. It can be useful. So yeah, I think it's fine to use.
Okay. We're going to take our final hand. Tony, please unmute and ask your question.
Yes. When someone's body does not absorb iron, even when they eat up their greens, they take supplements, iron supplement with vitamin C, what is the problem? Why the body doesn't absorb iron, and what is usually the solution for that?
Well, it could be a few things. It could be that they're losing iron faster than they are taking it in. It could be that they are not taking enough iron. Many times I have to double the amount of iron. It could be the formulation of iron. Different formulations are absorbed differently. So different formulations have different bioavailability. So somebody may have to switch the formulation, try a different, so instead of iron sulfate or iron gluconate, I mean, there are probably like 5 or 6 different formulations of iron. So it could be that they're not absorbing that one. And then it could be that their gut microbiome is very unhappy and needs to be fixed first. So those are all possibilities.
Hi, Dr. E. My apologies. I know you said it was the last hand. I just wanted to ask this question from Sister Angela Brown. She's asking, how do you advise on consuming flaxseed, as I learned it can elevate estrogen levels for breast health in women?
Okay, so flax seeds definitely should be ground. So I'm glad you asked that question. Don't take it whole. It should be ground flax seed. And foods and flax seed is one of those foods that can be helpful in breast health. So it can have isoflavonoid activity that can help with breast health. So I would grind it, make sure it's ground up. I have my coffee grinder that's dedicated just for my flax seeds. And so I put it in there, I grind it up for the week. I don't do it every single day. I do it in batches, put it in the refrigerator so it doesn't oxidize, and use it every day. I try to get to 2 to 3 tablespoons. And in combination with a lot of cruciferous vegetables, which have been shown to be very helpful for breast health. For people who have too much high estrogen levels, cruciferous vegetables can really help with pulling it out. And so ground flax seeds combined with a lot of cruciferous vegetables and a whole food plant-based diet is spot on for for healthy breasts.
Temperance. Ear. Rest.